McInerney from Croaky here at the Croaky Go Navigating Health event in Melbourne, and I have here Ryan Shields. Ryan, would you be able to introduce yourself and where you're from?
Absolutely. Well, thank you. It's a real honour to be here taking part in this Croaky Go Day. My name's Ryan Shields. I'm from VCOSS, the Victorian Council of Social Service. We're very honoured to be taking part in this day. We're here primarily to listen and to learn and to get a greater understanding of the system, how it works, how it doesn't work, and obviously what we can do to make it work better. I guess we'd contribute one general observation. At VCOSS, we always look at things. We look at every issue through the prism of poverty and disadvantage, and the absolute right of every person to lead a good life and a healthy life, no matter who they are or where they're from, what they look like, who they love, whatever it happens to be. Everyone should have the right to lead a good life and to be free from poverty and disadvantage. We know mental health affects absolutely everybody in our community. However, what we also know is that it affects people who are experiencing poverty and disadvantage most acutely. Poverty and disadvantage and mental health reinforce each other. They can exacerbate issues. They really are intimately linked. So I think when we discuss mental health, we need to also discuss poverty and disadvantage and vice versa. We can't look at either of them in isolation. Sorry.
No, sorry, that's fantastic. The social determinants of health, where we could wear on badges everywhere. Your CEO, Emma, she addressed the Royal Commission, and that's the thing. This is very timely here in Victoria that we have a Royal Commission into not just mental health, but into the mental health system. What were the main messages that VCOSS was trying to get across to it?
So that connection between poverty, disadvantage and mental health was a key one. But I guess going on from that, our CEO, Emma King, was able to expand upon some of the solutions as we see them. And that very much resides in the community. We don't want the first time someone interacts or gets help for a mental health challenge to be in an emergency department. That needs to be in a community setting. The first responders to our mental health challenges can't be emergency services, they must be community services. So, there's obviously a massive role for government and for everybody in this challenge, but I think, the real solutions lie, and we made this point to the Royal Commission, in the community, in community health services and in community settings, be that a neighbourhood house or schools or sporting clubs or, homeless shelters and the like. Everyone has a role to play, and all of those different bits of the system need to be playing their role if we're going to actually solve some of the challenges that are facing us.
What stops these issues of poverty and disadvantage from being brought into the whole picture, and what are the barriers more generally to those social determinants? And I say that knowing that VCOSS is involved in the campaign to try and get New Start lifted, which seems almost to be impossible to achieve. What are the barriers, and where do you see hope?
Well, there is hope because poverty is a problem created by us, and therefore we can fix it. We have the tools to change it. You're right, there's lots of different causes and drivers of poverty and disadvantage. Unfortunately, that also means there's no one solution. There's no silver bullet. If there was, 1 or 5 or even 10 things we could do to solve the problem, we'd do it today, we'd do it yesterday. There's lots of different bits, and depending what the key driver is, obviously impacts on that as well. But you're absolutely right. New Start, which is the federal support payment for people who are out of work, is horrifically low. It's been low for a long time. It's been stagnant, literally for decades. And VCOSS is a firm and a proud supporter of the Raise the Rate campaign, saying that rate should absolutely be brought up to something where people can actually live on it. The government speaks a lot about how New Start should be a springboard or a trampoline, to jump you or push you back into the workforce or whatever it happens to be. But at the moment, we know that New Start is so low that it's actually a poverty trap. It's so low that people are stuck in poverty and they can't actually do those other things which the system is designed to help them to do. Get on their feet, get through tough times, get a job if they're able to do so. So absolutely that is some low-hanging fruit. That's an absolute no-brainer to raise the rate of New Start.
And Ryan, just one more question about silos, really, in between sectors. And I used to work at VCOSS, and I understood very much that health seems somehow separate to the social sector. What would you say to the health sector about getting engaged on social issues, social service issues?
Oh, absolutely. Look, silos do exist, unfortunately. It's just a fact of life. And it's not just health and social services, although that's obviously correct also. All of these issues intersect and bleed into each other. And if we're being serious about addressing them, we need to break down those silos. We need to talk to each other. We often use the phrase joining the dots. We've got all these little dots, these little silos, whatever language you want. We need to join them up. We need joined up services. We need solutions that actually talk to every different bit of the challenge and of the sector and of the possible response, the arsenal. And we need everyone working together. So absolutely the first step of that is to break down those barriers and all get in the one room and all be on the same page and absolutely work together.
Did you love my segue into now we're going to go off and do that?
Absolutely.